the music would be so dramatic, but yeah, I'll go with it. All right, I'll just gently turn that down. Welcome back. Hi everybody, welcome back. It's Dr. Matt. I'm the guy that will give you the medical take on sporting topics, and today we're talking about a double head injury that occurred yesterday during a Premier League game between Arsenal Football Club and Wolverhampton Wanderers. Now yesterday, about 6 minutes in, there was a collision of heads between David Luiz, defender for Arsenal Football Club, and Raul Jiminez, a striker for Wolves. He was pretty nasty, and it has raised some massive questions within the footballing world and on my phone, basically. So the questions that are coming in are basically saying, why is it that Raul Jiminez was removed from the field of play and had to go to hospital, but David Luiz was able to continue to play? And there's been a lot of criticism about the decision to let David Luiz play. So I thought I would come on today, just come straight from work. I thought I'd come on today and just explain why that was the case and the position that the Arsenal doc was in. I know the Arsenal doc personally, he's a brilliant doctor, very conscientious, very safe, and he wouldn't have made that decision lightly. As I always say, if you're interested in this type of content, this type of sort of niche insight and perspective, make sure you hit subscribe, and I've got a follow-up video to this coming up, so as long as you hit subscribe, you'll get the notifications. If you do enjoy this one, remember to like, share and comment. Just get involved, basically. But other than that, away we go. Now I've got a clip of the incident that we're going to watch, and we'll see what the copyright gods say, but it will lead me into my conversation. Okay, so we'll start it off and we'll put it on a loop just while we talk. So yeah, Williams arms up, the cross whipped in, bang. That's a horrible incident. I wouldn't want to be the doc on the sideline there. That is a horrible incident. Yeah, both doctors and physio team come sprinting on, and you can see the players are not in a good way. What you need to remember though is how it looks on TV is not always how it is when you get out there. Interesting, you can see from this angle that Jimenez is completely KO'd. That's quite scary, to be honest. If I was on the pitch, and the Wolves doctor's done brilliantly to keep his cool. There you can see him radioing in to the sideline saying, we need everybody on. Yeah, that's exactly what I'd have done. The Arsenal doc is also waving people on, and physio's talking to the player. Now, okay. I'll let the clip continue for the time being while I jump straight into this. Spoiler alert, Raul Jiminez ends up going to hospital and having to have an operation. I've got a separate video on that coming where I talk to a neurosurgeon directly, and he's going to explain it all to you. So I'm going to leave that aside for a moment and talk about the decision to let David Luiz play on. Now, there's two principles that you guys really need to know before we can move forward in terms of head injuries on the pitch. Number one, not all head injuries equal concussion. And if you think about it, there's loads of sports which are more physical than football, which have more head collisions. And not everyone in those sports gets concussion. So you can appreciate not all head injuries are concussion. The second thing you need to know is that you cannot diagnose concussion on a pitch. Even when a player gets taken off, it's taken off with suspicion of concussion. Concussion is if I was to define concussion, it would be a minor traumatic brain injury which causes temporary change to brain function, okay? And that is something that needs to be assessed over a period of time using clinical signs, clinical symptoms, cognitive assessments, and knowledge of the individual. So it's a complex diagnosis. You cannot just diagnose it on the pitch. So everyone's saying, oh, Luiz was clearly concussed, take him off. That is not true. You can't make that diagnosis. Simple. Right? So those are the two principles. Not all head injuries are concussion, and you can't diagnose concussion on the pitch. So if you can't diagnose concussion on the pitch, what are the doctor and the physio doing when they come on? What they're doing is they're doing an assessment to try and weigh up the likelihood of this player having concussion. And sports physicians and physios do receive guidance on how to do that. Now, I'm 100% sure the Arsenal doctor and physio are following the relevant guidance, and I'm going to explain the guidance to you just briefly, and I'm going to bring up some pictures so you can see the actual concussion recognition tool that I used to use when I ran on the pitch, and something similar that the Arsenal doc will be using, right? Now, when you run on the pitch, the first thing you think of is red flag, which means that the player is coming off no matter what happens, okay? So in the case of Raul Jiminez, he was knocked out. So loss of consciousness is probably the biggest red flag. If the player has lost consciousness, they're coming off. There's no real confusion about it, right? The other 8 are neck pain following a head collision, double vision, weakness or tingling down either arm. That's particularly scary. Severe or increasing headache as the assessment goes on. A seizure, I've seen that happen before, and that's quite scary. Red flag, you're off. Vomiting agitation, restlessness, or combativeness. You probably see it more in rugby when players have severe head injuries and become really combative with their medical team. That's a red flag. And finally, just deteriorating consciousness, right? So those are the red flags. So if the Arsenal doc and physio came on and any of those were the case, David Luiz would have been off. So we can assume he did not have any red flags. So how do they make this decision? Okay, they look at signs, they look at symptoms, they do a little memory assessment. Okay, so in terms of memory assessment, there are 5 questions that we ask on the pitch. They're called the Maddox questions. So it's what venue are we at today? What was the score in our last match? Who did we play in our last match? Who last scored in this game? And which half are we in now? All questions to that likeness. The players should really be getting all those questions right. You might let them off with one if you know the player well and you know they're just a bit, out of the loop or didn't play the last game. Might ask them some different questions just to make sure they're oriented in time, place and person. So what you need to bear in mind is that these clinicians, the doctor and the physio, know these players in and out. They travel the players, they see the players every single day, so that they will know if David Luiz is acting normal or acting abnormal. So all that time that the physio spent talking to the player is asking him, okay, what symptoms do you have? Do you have headache? Do you have double vision? Do you feel blurry? Are you not quite right? Etc, etc. And they will be able to gauge if there's something's not quite right with the player. Once you do that, they then sit them up, stand them up, and then ask the questions again. You're getting tingling down your arms? Are you not feeling right? How are you feeling when you're walking? Are you feeling unsteady on your feet? All important questions. But if the player passes all those assessments, then he gets the green light to continue. And I know on TV it looked dramatic, but you have to have faith in the clinician that knows the player in and out. When I say we're with the players all the time, I mean we're with them all the time. If they're at lunch, we're there. If they're at dinner, we're there. If they're in the hotel, the doctor's in the hotel. If we're traveling on the coach, the doctor or the physio's in the coach. Trust me, you have to have faith in these physicians, and I think it's unfair to cast aspersions on the Arsenal medical team's name. There's other questions, should we have a head injury assessment substitution, etc, etc. I'm not going to comment on that. For me, I've always had the controversial opinion that there just should be unlimited substitutions for various reasons. If there's interest, I will do a separate video on that. I'm not militant on it, but I think it would be a good idea. That would include being able to assess for head injuries. So hey, if you're in the unlimited sub movements, leave a note in the comments. So that's why David Luiz stayed on. Jimenez was in a completely different situation. As I said, the main things to take away from this video is that you cannot just diagnose concussion on the pitch. It's suspected concussion, and not all head injuries are concussions, and that's what the doctors and the physios get paid to do. So we have to have faith with them. We have to leave the clinicians to make that decision safely. They always have the interest of the player and the safety of the player at the heart of all they do. I'm all for increasing player safety, and any ideas, anything that will increase player safety, I'll be behind. So definitely not playing down the importance of head injuries. I'm just saying, appreciate the fact there are systems in place that protect the player and help guide us as doctors, as physiotherapists. My next video will be about Jimenez, what operation he had and his return to play. So that will be interesting. If you like this, if you found it interesting, make sure you like it. Make sure you comment, get involved, and share it. Definitely share it, because that always helps the channel. Anyway, you guys take care. I'll see you on the next video.